The tourism conversation has been among the top business-focused subsectors, with President Museveni recently emphasizing the significance of strengthening Uganda's private sector so as to increase the country's tourism export earnings. He expressed his desire for every tourist to spend a minimum of $10,000. However, the Association of Uganda Tour Operators has pointed out that insufficient support from government to the private and cities need for extra investment in various fields to ensure better tourism export earnings as the sector devises better products to support tourism.
It's no secret that the tourism industry is one of the highest earners, into the country. But what the Excellence is doing and in making sure that export earnings increase using tourism as an influential industry is a good thing, but I do think that the first thing that needs to be done is to invest into the industry. Much investment is needed to ensure that the earnings that are desired get into the industry. And that will come through especially supporting the private sector, who are the real drivers of the tourism industry. So they need to inject some more money into the industry and especially the private sector because they are the drivers of the industry. That is the only way that will have the earnings increase.
Tourism emergency services has been added to the catalogue of private sector developments to leverage the industry with emphasis on safety. Through their collaboration, Maisha Air Ambulance and Amref Health Africa have worked out means to enhance the reputation of the industry in Africa by promoting high-quality medical care for tourists. This envisions bigger visitor numbers to the region.
As long as you become a member at a very low cost, the annual premiums for what we call the Maisha cover is as low as $66 US. But if you don't have this cover and you need to be evacuated for a health emergency to Nairobi or elsewhere in the world, it could take you as much as $1,300 US for the same service. So our encouragement is that every individual can subscribe to this Maisha cover, so that in case of an event or an accident or an emergency, you're able to secure yourself an evacuation, at least to Nairobi, for as low as $66.
Basically, our air ambulance services mean that we're able to evacuate or transport somebody in dire need quickly and professionally to a center where they can get professional help. For example, if somebody is up country or has an incident or accident in a national park, for example, we are aware in our region specifically that hospitals can be very far from the point at which these people get the problem. Ideally, somebody should not be more than 30 minutes from a hospital, but that's not the case. In our place, we find ourselves hours away from a hospital, and that's where the need to use an aircraft for a safe, fast transfer becomes very important. So those are the services Amref Flying Doctors offers.
Despite implementing measures to ensure tourists' health and safety, the initiative has faced various challenges, notable among the many being infrastructure inefficiency.
Infrastructure problems that we experience quite a lot is that majority of the airstrips in our region are not lit. They're not tarmacked, they're not fenced, they're not secured, and they are mostly unmanned. So, for example, you may find animals on the runway, or you may find people riding motorbikes. Some of them can be as notorious as holding markets on the airstrips on Saturdays.
Uganda Tour Operators Association is convinced that the availed emergency package is affordable and urges tourists to embrace the cost-effective rates provided by their service.
The Association of Uganda Tour Operators is in a partnership with Amref Flying Doctors, and this partnership helps in such a way that where the tour operator is operating individually and not as part of the association, they stand to miss out, because we've negotiated a rate where the tour operator that is associating with the association already gets $24 per 30 days. Yeah? So if you're not operating within the association, that means that you lose out on the freebies that is given by Amref Flying Doctors. Because while as the person out there is paying $32, the auto members are paying $24. So that is a plus for the tourism industry.
Emergency service has been locally predominant on road as opposed to aviation. Tourism agencies are now committed to enhancing their reputation and services as safe and reliable. Eventually, this is expected to attract more tourists. Ronana Habwe, Smart24 TV, Business Today.